Headache, as far as I'm concerned, is similar in both young people and adults. It presents similarly in both groups. And we know that migraine headaches are genetically based disorder. It's a very common disorder. And if I look at young kids, younger than maybe in the preteens, maybe 4 to 5% of the population, when we reach the teenage years, that number goes up dramatically in girls. And by adulthood, we see migraines in 20 to 25% of women, about 8% of men. So this is largely a disease of women, and about a 3-to-1 ratio women to men. We also know that migraine is a neurobiologic disorder. There are physiologic changes that are really specific for people who are prone for migraines. And what I tell people when I see them is people who have migraines have what we call a sensitive brain. Their brain responds differently to stimuli than other people. Poor sleep, poor eating, dehydration, stress, weather changes, hormone changes. Probably the most common trigger I find is stress in both adults and teenagers. Very, very common trigger for migraine headaches. And what happens is you get exposed to whatever that trigger is for yourself. And again, it's sometimes stress or poor sleep in teenagers, dehydration, poor eating habits, whatever that is. And that trigger causes neuronal excitation or activation of your nervous system. And when your brain gets excited, your nerve terminals release chemicals onto the covering of your brain that we call your meninges, on your blood vessels. And these chemicals are irritating. They cause inflammation of blood vessels, they cause vascular dilation, and they cause activation of essentially your pain system in your brain. And when you activate your pain system, you experience this phenomenon that we call a migraine. And it's really the same disease entity in kids that we see in adults. Now, I think adults frequently have more frequent headaches. They have more prolonged headaches. Sometimes the headaches are more severe. Nonetheless, migraine in kids is the same as migraine for adults. When I see young people, their headaches are usually shorter. They may last several hours, as to adults who have 6 to 12-hour all-day headaches. Kids have less nausea and vomiting with their headaches, less light sensitivity, noise sensitivity, but they have the same features. And this is a disorder that can be diagnosed very early. 3 and 4-year-olds can have migraine headaches. They may not be able to describe and characterize their headaches, but they'll hold their head. They'll be light sensitive. They'll get nauseous. They'll throw up, and have very typical features that we may well see in adults. So the disease process is the same. And interestingly, we treat the disorder the same in young people as in adults. We may not use the same doses of medications. We may lower the dosing for kids based on their lower weight and their smaller size, but we use the same medication in general in young people as we would use in adults. When I discuss triggers with my pediatric population, it's almost identical to what I'd see in adults. And by and large, the most common trigger I see in young people is still stress. And the incidence of anxiety in kids with frequent headaches is also very high, just like we see in adults. We see increased depression in kids, just like we see in adults. Sleep disorders, very common and frequently a common trigger. And, we talk a lot about food triggers, and food triggers are probably less common than we discuss, but nonetheless, we still watch for things like MSG, caffeine, nitrite exposure, sometimes less common things like peanut butter, tomato products, there's a whole host of different food products. And treating young people, I think, is a little different than treating adults, and often much easier because young people aren't quite as entrenched in the bad life habits that we all have as adults. And it's easier to make lifestyle modifications, and sometimes easier for parents to set limits that make a big difference for the young people. So I do my best with really working on lifestyle modifications. We spend a lot of time talking about sleep habits, making sure kids are getting to bed on time, getting off the computer, getting off their phone. We talk about hydration, making sure people are drinking as young kids, I expect 4 cups of water. Adolescents, maybe 6 cups, and as an adult, 8 cups of water or more. And when people are physically active, and if they're running or swimming or exercising vigorously, they need to be hydrating more. And then, of course, we talk about work and study habits. Invariably, my teenagers are staying up, kind of burning the candle. They're up till midnight. They're up at 5:30 to 6 in the morning, and they're invariably sleep deprived. So sleep deprivation is a very common trigger for young people, and getting the young people to work on a normal sleep schedule and get to bed on time and get enough quality sleep, very, very important, and also very difficult. You know, these teenagers who are in high school have a tremendous workload. They've got a huge amount of stress in association with their work and worries about college and getting all their work done and being successful. And they all want to sleep on the weekends and never get enough sleep during the week. And it's really quite difficult, and trying to make those behavioral changes is critical and very important. I probably use ancillary services in the young people more than adults. So I'm a big fan of counseling for young people for stress and anxiety management. I found biofeedback to be very helpful in young people. And I use a lot of nutraceutical medications like vitamin treatments for managing migraines. And a lot of young people do very well with medications like magnesium, riboflavin, CoQ10, butterbur, natural products like that, which can be very helpful for headache health and have much less side effects than some of the prescription medications we commonly use. I think one of the other problems we have in the pediatric population, just like in the adults, is overuse of over-the-counter medications. So a lot of kids are using the same medications their mom and dad are using because parents are all taking, you know, in the South, it's goodies, it's BC powder, it's Excedrin, migraine, Excedrin tension, Excedrin sinus, whatever your over-the-counter medication du jour is. And a lot of people are overusing these medications, and then we get into a problem with medication overuse or rebound headache. And I think there's also an overdependence on medication for headache relief. So a lot of times my answer is, if you've got a headache, why don't you lay down for a little bit, rest and relax, drink some fluids, try to download your stressors, and then get back to functioning and get back to life. And oftentimes that takes care of things. So, and then if that's not effective, and we've worked on the behavioral things and the lifestyle things, then we'll be more aggressive with other types of medication. When we look at medication treatments, I use the same medications as acute treatment in kids as we would use in adults. If somebody has a mild to moderate headache, they may do very well with your routine over-the-counter analgesic, Tylenol or ibuprofen. I think ibuprofen generally works better. Excedrin migraine works very nicely if used infrequently. And then we can use migraine-specific medicines like the triptan medications in the pediatric population, even the young kids, just like you would in adults, but we use lower doses in that population. And generally they're safe and they're very well tolerated. When I see kids who are having more frequent headaches, and we're looking at, you know, more than one headache a week, we talk about preventive therapy if our behavioral approaches have not been effective. And again, just like the adult population, we'll use similar preventive medications. If somebody's having mild or moderate frequent headaches, I'll start with a combination headache vitamin. And there's a number of them out on the market, but I think Migravent, MigraRelief are both very effective and very safe. We used topiramate, beta blockers, calcium channel blockers, tricyclic antidepressants, a number of neuromodulators, just like we would in the adult population. And the pediatric population does very nicely with these. Other options for preventive therapies are things like nerve blocks, and the headache specialists in the community, I think, are very adept at using nerve blocks and frequently use them. And they're safe and very well tolerated. Usually we use a combination of lidocaine and marcaine. I tell my patients they're uncomfortable briefly, but people do remarkably well with them, and they're super safe and well tolerated. In older patients, or even in younger patients, we use a fair bit of botulinum toxin. And I think botulinum toxin for chronic headaches has been very effective in the pediatric population, just like in the adult population, is a good option for many of us. And it's something to keep kind of in our back pocket if you're dealing with somebody who's got frequent headaches. But, I think, actually, we really manage headaches in kids just like we would in adults. And I think the most important management technique is behavioral and lifestyle modifications. and dealing with things at an early age and addressing these things at an early age before people get too entrenched into their bad habits. And if we do that, I think we're very, very effective in this population. They do very nicely. Most of my kids do remarkably well, and we see less frequent, milder headaches, and it's a pleasure. So I think I'm going to stop for a few minutes and see if people have questions about that or about my approach to treating young people. I see kids from, oh gosh, several years of age for headache complaints up until, people who are quite elderly. And we manage them very similarly, but we manage the medications very differently. And I spend more time on behavioral management in kids because I think it's safer.